Everybody, Ziv Simon here. I'm the creator of Surgical Master. In this video, you'll see a conversation I had with Dr. Greg Kurtzman from Maryland. He's another super GP that is very well known in the online community. Beautiful cases, is well published. At a very high level of implant and periodontal surgery, he presented 2 posters at the last AAP conference. And we had a conversation about the unique bone graft that he's using and why he's using it. He gave some advice to general dentists just starting to perform surgery. He talked about some of the challenges and also gave me an interesting tip on local anesthesia, how to avoid a palatal injection, which was very helpful to me. If you're a GP, don't get discouraged if you don't have the formal designation of a specialist. Get inspired by Dr. Kurtzman and Dr. Tawil I presented last week. Both are GPs and performing surgery at a very, very high level. So get inspired, get to work, and enjoy my conversation with Dr. Greg Kurtzman. Everybody, Ziv Simon here. I'm the creator of Surgical Master. I'm here with Dr. Greg Kurtzman from Maryland.
Yes.
Greg, finally, nice to meet you. Finally to see you. We've been corresponding online. I think there's 90% of my posts you respond to, and you always have very constructive comments.
Well, they're excellent posts.
Thank you, and great illustrations and everything. And you're presenting 2 posters here. So I wanted to talk to you about a couple of things. Number one, your love for bacon.
I do love bacon.
Okay. And number 2, I wanted to talk to you about the topic of your posters. And what's in the posters, actually? Tell me about it.
Basically 2 research studies that were done on NovaBone, which is an alloplastic material, one for sinus grafting, either crestal approach or lateral approach. And we saw a significant bone fill with this. The material disappears completely, is converted over to bone in 4 to 6 months with no residual particles left. And the other is on using it in furcations, and we compare that to PRF, and we found a statistically increased benefit using the NovaBone compared to PRF to fill the furcations.
So the NovaBone, if you had to classify it, we have allografts, we have xenografts, we have alloplasts. So which group is that?
It's an alloplast.
It's an alloplast because, you know, in the past, as you know, we tried to stay away from alloplasts. Well, so what's the difference now?
The problem with the alloplast, and this really was, it's the second generation compared to PerioGlass. Okay. The problem with the alloplast is left particles there indefinitely. And some of those, like PerioGlass was one, HTR was another, they basically never disappear completely. Where this material fully disappears. It was used in orthopedics, and they brought it over into dentistry for the last 5 or 6 years. And it's really a great material. We're seeing a lot of good results with it. It really totally converts over. It's very osteoinductive and osteoinductive, okay. And it stimulates bone formation.
So compared to all the other materials we have on the market, let's say, you know, just mention a couple of names, Puris and Mineros, and of course autogenous bone, how does that compare in your experience? You have a lot of experience.
Yeah, in my experience, it does better than autogenous bone because it's there longer. The problem with demineralized freeze-dried bone, it doesn't last long enough. Okay. It disappears. You need something that's going to be there for a couple of months, so it's going to slowly convert over, pull cells in and blood vessels. It's a putty, so it's easy to shape and keep its form.
Okay.
We found very good results with it. Okay, it's easy to handle.
That's good. So, you know, believe it or not, I was following your career from a long time before Facebook, and you know, I know you put your hands in so many things, even suturing. You have an article about suturing.
Yeah, I did some stuff with Lee Silverstein some years ago, the Suturing King. Okay. We did some articles together on that.
Yeah, and you know, you're a general dentist.
Yes.
And you work at a very, very high level. In your opinion, if you look at the general dentistry world, where are the major challenges dentists have at the moment doing surgery at a very high level, like yourself?
Well, I think that, you know, the problem is that too many people are taking weekend warrior courses, and they figure they can just throw implants in.
What does that mean? What does it mean?
You know, you take a course for 1 day or 2 days, and now all of a sudden you can put implants in. And I remember a few years ago, there was a guy who had never placed an implant, took a course, put a mini implant, and put an immediate final crown on it.
And it probably worked.
It worked, but you know, I guess he only showed the immediate results. And then 2 weeks, 3 weeks later, he said, now I'm going to be teaching a course. I go, you're teaching a course? He goes, yes. So is the philosophy now do one, now teach it? And so I think that people aren't getting enough education, and really it's how to manage complications. And too many people are just jumping into it, and then they have complications, don't know how to handle it.
Great. So that's important to know. What is the number one innovation in the past year that you incorporate into your practice? Because you always up onto the new things, the things that can help you. What is the number one thing that you now are doing that is new and is helping you more?
You know, there's a couple of things. I think one of them is lasers. I think we're seeing more laser treatment, and it has really usage in a lot of different areas, uncovering implants, perio treatment, gingivectomies, other things.
What type of laser? What type?
Diodes. I think the hard tissue lasers, like the Light Touch from AMD, is allowing us to do cavity preps with no anesthesia. I think we're seeing it in improving endo obturation because we're getting more bacteria killed, better irrigation with it. I think other things are the dental vibe, making injections easier. The one thing that really changed my practice was Septocaine. In 2000, when it got approved, I switched over that. I have not had any problems, and the patients love it. I don't get palatal injections anymore because I use Septocaine. So I think
hold on. How do you avoid a palatal injection? By using Septocaine.
Septocaine on the buccal, it just penetrates so deeply through the arch, and it numbs the palatal tissue also. So I rarely ever have to give a palatal injection now.
For an extraction or an implant?
Yes.
Okay.
Yeah.
Okay.
Fact,
so I learned something new today.
I've had a couple of implants done myself, and I said to my perio friend, I said, don't give me a palatal. No, I have to. It's like, and he insists on it. I'm like, I hate palatal injections. They're uncomfortable.
Every patient hates that. I mean, and they do hurt.
Yeah.
So, and that's just such a, I'm so glad we're doing this, having this conversation. Sure. So you would infiltrate in the buccal mucosa, a carpule, 2 carpules of Septocaine?
Yes. And it just penetrates through, so you're getting total anesthesia on the teeth, and you're getting anesthesia on the palatal tissue. Worst comes to worst, in a case, I'll give a little bit into the papilla if I need it, but that's rare.
Okay, that's a wonderful tip. Greg, it was really nice to finally meet you face to face, and I have one more question for you.
Sure.
Is turkey bacon as good as normal bacon?
Turkey bacon is, it's got to be real bacon.
Okay, good. It's good to know. Great to meet you as well, and we'll see you soon.
Sounds good. Thank you.
This is Ziv Simon from Surgical Master with Greg Kurtzman from Maryland.